Good afternoon, everybody. Welcome back to Connecticut's Old State House. I'm so happy to see some returning faces from last week. Thank you so much for coming back. And welcome to our second program in our Ctrl+Shift+Democracy series, Big Data and You. My name is Mariana Garcia. I'm the Public Programs Manager here at Connecticut's Old State House, and I'm just delighted to have you today here for this program where we will be exploring the profound impact of big data on government and citizens, its potential to improve our lives, enhance governance, foster transparency, address social issues, and also the dangers of data bias and data security. We're going to have a really wonderful conversation with our honored panelists here. But before I introduce our panelists and we have our program started, I would like to welcome a very special guest tonight, United States Senator Richard Blumenthal, who is here to give us some remarks before we begin our panel. Thank you so much for being here.
Well, thank you for having me. Thank you to this very distinguished panel. And thank you for letting me usurp a little bit of your time. I think what maybe is most relevant to this conversation is perhaps an update on what is happening in Congress concerning big data and you. This issue has been one of long-standing interest to me, going back to my days as Attorney General of the state 14 years ago. And what I'm doing about it in Congress is now trying to legislate some standards, privacy safeguards, not only against the breaches that can occur, but also the collection practices without consent, monetizing it, sometimes weaponizing data. I don't need to tell anyone in this gathering about how dangerous that can be. But one cause for hope, I think, is that the efforts to safeguard data are increasingly bipartisan. That may seem strange as we literally watch the unfolding events at the national level, but to people like yourselves who watch closely, I'm sure you see the populist, so-called populist strains on both sides of the aisle that say, in effect, it's my information, it's my data, it's my life, I should be in control of it. And one evidence of that bipartisan cooperation is the bill that Senator Josh Hawley and I have developed on artificial intelligence, which concerns the use of data in ways that may be hostile to individual consumers. We have proposed the first comprehensive bipartisan framework for oversight and regulation of artificial intelligence. It would involve standards, licensing, a regimen for oversight through an independent entity, controls on how data can be used in artificial intelligence, and as well some licensing so that whatever the models are for artificial intelligence, they can be judged to be safe and effective. The idea of safe and effective is not one new to this area. Obviously, as you know, the FDA, Food and Drug Administration, has a standard of safety and efficacy that's applied to new drugs. And our view is that artificial intelligence models should have to pass a similar or even the same kind of test when it comes to models that make use of data, collecting data. As you know, the large language models make use of extensive data, consumer data, data that's out there. So this is an area where we're going to continue working. Josh Hawley and I have very little in common in terms of our voting records. We are different in many of our beliefs on foreign policy as well as domestic issues. But on this one, we've begun to work together, and I'm hoping that we can have bipartisan cooperation that may provide the basis for privacy standards that can be adopted into federal law. So I wanted to give you that update. Hope that I can work together with you if you have ideas, proposals for legislation. I know the panel's going to be talking about some of them. And again, just want to thank you for the work that you're doing. Thank you.
Thank you so much, Senator, for those words, and thank you for joining us tonight. Thank you. All right, so we're about ready to begin our panel, but before that, I'm going to have a conversation with the panelists here. I have a list of questions. Some of them have been submitted by you, the audience. And after the panel, we're going to have a brief Q&A. Will you be able to raise your hand and ask any questions you may have? Please wait for the microphone to be in your hand before you ask your question. This evening is being recorded by our partners at CTN. It's being live streamed on YouTube and Facebook. And in order for the cameras to pick up your voice, we do need you to have the microphone. So please just raise your hand and do wait for the microphone to be brought to you. And during the program, if you want to grab some snacks, please feel free, some refreshments. If you have a parking stub from State House Square Garage, visit my colleague downstairs in the visitors desk, and she'll be able to validate it for you. And yeah, without further ado, please allow me to introduce our esteemed panelists. All right, so first off here to my immediate left, we have Scott Gaul. Scott Gaul is the Chief Data Officer of Connecticut at the Office of Policy and Management, where he supports the state's effort to improve data use. Previously, Scott worked on research, evaluation, and community indicators at the Hartford Foundation for Public Giving, and before that, he served as Director of Analysis in Washington, D.C.-based Microfinance Information Exchange. He holds a master's degree in international affairs from Johns Hopkins and a bachelor's degree in mathematics from the University of Chicago. Thank you so much, Scott, for joining us. Next to Scott, we have Michelle Riordan-Nold. I'm sorry. Michelle is the executive director of the Connecticut Data Collaborative, which is a user-driven public-private partnership that educates, liberates, curates, and democratizes data for public consumption to help drive planning, policy, budgeting, and decision-making in Connecticut. She has worked in research capacity for most of her career, examining a wide range of policy areas and programs, including healthcare, economic development, state tax credits, and energy-efficient programs. She holds a bachelor's degree in mathematics from Boston College and a master's degree in public policy from the University of Chicago. Thank you, Michelle, for joining us. And next to Michelle is Susan Smith. Susan Smith is the Department of Social Services Director of Business Intelligence and Analytics and serves as the agency's data officer. A state employee for nearly 28 years, she held various positions at the Connecticut Department of Children and Families. Susan is a member of the Connecticut Data Plans Equity Affinity Group and a planning member of the Equity Community of Practice that is convened by the Connecticut Data Collaborative. Susan Smith attended Williams College, double majoring in psychology and studio art, and went to Duke University for law school. And finally, last but not least, Russell Blair. A former journalist, Russell Blair is the Director of Education and Communications at the Connecticut Freedom of Information Commission, where he manages the agency's training programs as well as answering questions from the state and local officials, journalists, and members of the public. Prior to joining FOI, he worked as Director of Communications for the Hartford Public Library, and before that spent 10 years as a newspaper reporter and editor at the Record Journal in Meriden and at the Hartford Current in various roles. So thank you all so much for joining us today. Let's start with our questions. So first off, as always, I would like to go over a little bit of vocabulary just to make sure that we are all talking about the same thing. These are very complicated concepts. So first off, if you could all briefly let us know what, based on your experience, how would you define big data? And what can people do with it? And also, are there any other concepts besides data that you would like for the audience to know about before we start our conversation today? We can go in order.
You have a panel of introverts, I think. Someone asked me this earlier, and I'm going to answer it because otherwise Susan will make me answer earlier. But someone was like, what's big data? And I flippantly said, it's just a lot of data. And so that, I think it was like, okay, there's some implications to that. So it means it's like a large volume of data. It's more than you can just make sense of on your own. And so that means you need like some tools or techniques or things to analyze or draw some sense from it. And those are the kinds of things where you're like adding complexity to how are you understanding what's in the data set. That's where you have room for bias or some kind of issues to creep in because you're using something to analyze data that you don't really necessarily have a ton of control over. And so with the increasing, sort of move to digitizing different types of resources, collecting more and more information from people through lots of different channels, like you can get these big data sets. They're just more than a person can kind of analyze or make sense of on their own. I think that's sort of the core of it. So it's a lot of data, but that comes with some complexity, and that means you need different things to make any sense of it if you wanted to, and that's where there's some challenges that come in.
Thank you.
Sure, you want me? I can add to that. Big data it come in many different forms, like structured, unstructured, or semi-structured data. So, structured data we think of like financial transactions. Unstructured is more like text-based data, and then semi-structured could be logs of like computer processes or like back-end kind of documentation. Just to add to what Scott said, it's so large that it often requires more statistical power to analyze it. Excel is not, and higher sophisticated statistical programs to make sense of it. Excel is not, you can't use Excel for big data because it's just so large in volume.
Sure.
Yeah, I think the definitions that y'all both promulgated just absolutely cover it. I think just one of the pieces to really kind of think about is that within that are various types of data. And so that's kind of the nature of some of the information in there that may be very sensitive, that information that, as Senator Blumenthal noted, really does need to be protected. So it does obviously also kind of implicate not only the types of tools that we use to analyze it, but obviously what we need to put in place in order to protect and safeguard those data. And it also makes us really think about the governance in terms of, how do we approach these data? So, large data doesn't necessarily mean that it's complete data or that it's necessarily telling the full story on the populations that are in there or potentially the populations that are not a part of it. So it really does have a lot of implications in terms of the various aspects of, and we'll talk a little bit about this later in the presentation, about the data life cycle that we have to consider when we're engaging big data.
Thank you so much.
They're really the data experts, so I'll defer to them on the definition. But I think one important thing to note, and I'm sure we'll go into this too, but the phrase kind of garbage in, garbage out, I think that's really important, especially considering some of these larger data sets, and as you were talking about, things like data bias and accounting for that, and also developing tools that can handle these types of data sets appropriately, and so that if you're using big data to make a decision, you can rely on the analysis being accurate. So I think it also sounds a little scary too. I mean, big data and it sounds it sounds scary, and maybe to some people it is. But I think as we'll get into, there's a lot of good appropriate uses of it. But I think also with that amount of data, it's important that you know how to properly analyze it, and if you're drawing conclusions from it, that you're doing that in the right way.
Right. Thank you so much. And could someone just quickly define what a data set is?
I think of a data set as all the elements within like a particular subject that you're looking at, or we think of it as like a program, or some of the state data, all the licensure data that's captured on a daily basis.
I think the sense of it is it's usually something that's like more designed. So it's just, this is intentionally, the state collects licensing data. So we'd say like, okay, this is the licensing data that the state collects, or you'd have a data set for an analysis. And so there's clearer boundaries around it. It's usually for some purpose. and big data has messier boundaries, is not necessarily used or collected or used for a specific purpose. They're pulling and kind of mushing together different things. And so I think that's sort of that's I think colloquially the sense in which, I don't know, we'd mostly use it.
Okay.
I wanted to just add, you said, are there any other concepts? I think in this, the space that we work in, we work a lot with public data. So not necessarily big data, but that's something else that I know everybody here on the panel is also familiar with is public data and then open data.
Okay, so thank you. All right, so Scott, why don't you walk us through, because we know that the government collects a lot of data from everybody, but why does the government need so much data, and what kinds of data does it collect?
One thing I will try and make clear, a lot of times people think the government has a lot of information, and in many cases we have less than you would think, and so I'll just kind of try and go through like why the state collects data. The term, as someone mentioned earlier, the term big data itself is kind of ominous. Big brother and big data are sort of adjacent terms to one another. So I don't think anyone likes the idea of kind of like the state collecting things without clear intent or purpose. But that's not the way we do things. So I'll explain sort of what we don't do and then cover kind of things we do. So things the state does not do, and this is state of Connecticut, but it's true for every state in the country, towns, and the federal government too. We don't collect data out of curiosity. We don't collect data because like, oh, this is an interesting topic, or I'd look at this. We don't collect data for research purposes. We don't say we're gonna just collect this to study this particular topic, and it's not collected passively. So a lot of kind of big data sets are sort of like gathered by something happening, people using social media or something. So we don't collect data without clear intent or purpose. The way data is collected through the state is to usually implement or support some type of policy or program. So the state is doing the business of government, which is implementing policies and running programs, delivering services, running schools, getting people fishing licenses, managing public benefits programs, licensing different types of things. So that's what government does. As a byproduct, we have to collect data on that. So if the state is licensing businesses or food establishments, we have to collect data. What kind of establishment is it? Where is it? Who's the owner of this establishment? And so those are things that data is collected to run or implement or operate some kind of program or implement some type of policy. So how do those things get there? They're through, it's kind of apropos, Senator Blumenthal was here at the beginning, because those policies are put in place by your elected officials. So people vote, we're in a democracy, people vote, you elect officials, the officials in the legislature, they make the policies, and then I'm in the executive branch, Susan's in the executive branch, we execute those policies. And so when we're doing something, we're collecting data, it's because some policy or some reason is in place that says you should collect this. You should run a licensing program so we know if food establishments are safe and secure and there aren't risks of illness or whatever would come out of that. So we're collecting data to implement that program for that purpose. And that's it, really. Like it's just limited to that. There's some discretion, people can decide, do I want to collect like the address or the name? There's choices that the state makes through the agencies, but really the things the state collects are to do the business of kind of operating and running the government, running those programs. And so on, which people, again, rightfully, the trust in government is often low in some areas with particular populations, and so that's a very real phenomena. And so I understand why people are skeptical of kind of government collecting data or using data, but I think just as much as possible as we can reinforce that when we're collecting data, it's for a clear purpose, there's a basis for it, there's some policy or some reason that we're doing that. And one of the things we do in the state, and Susan is one of the people in the agencies that kind of implements this, is we try and make clear every type of data the state is collecting, so we list them all out and list why are we collecting this, like what's the policy behind this? You're collecting licensing data, what's the policy behind the licensing data, who's responsible for it, where does it sit, so that people have a sense, what is the state actually collecting, why are they doing it, where does it sit, who has kind of access to that, are there laws that restrict access to it in some fashion? So that doesn't address the trust issues that people will have, again, for very good reasons with government, but that we try and do that to make sure that we're explaining the limits to what the state is collecting for data and why we're collecting the data that we do have.
Thank you so much. And speaking of access, Russell, I was wondering what type of government data that, as Scott already explained, is actually available for all the public to access for their own purposes, right, through the Freedom of Information Act. And how does someone go about getting this data?
Sure. I think that really piggybacks nicely off of what Scott was talking about. People, if people are mistrustful of data sets or they're not sure, a lot of that data can be accessed through, the Freedom of Information Act. And, I'll talk about that in a second, but I'll also say, I think a lot of the state agencies that collect data do a really good job of proactively having that data available, on their websites. There's certainly, OpenCT. There's things the Comptroller's Office runs if people are interested in compensation benefits of state employees. If people are interested in vendors that are getting business with the state, all that is proactively put online, by those offices. So some of that information you don't even need to file a Freedom of Information Act request. It's already been put there publicly available. But really, I think another thing Scott touched on, this data is being used to conduct the business of government. If you look at the definition of what's a public record in the Freedom of Information Act, it's records pertaining to the public's business. So because this data is being conducted to be used, to make decisions about government, it's a public record, and people can make requests, for those data sets. There's always a concern about kind of privacy versus access to public information, and we'll talk a little bit later about how you find that balance. But I would say, by and large, the types of data, the things that you mentioned, licensure information, you could make a request if you're interested in, I want to find out, how many people have a certain, maybe you're looking for an occupation, you want to find out how many people in a certain community have a license to do something, you could look that up. You're hiring a home improvement contractor, you can go look up on the Department of Consumer Protection website, do they have a license or not? Is their license expired or not? A lot of this is proactively available, which I think is really beneficial and I think is important because, the Freedom of Information Act is a tool and you can use it, and it's quite simple, really. You just have to, write a letter or an email to the agency that you're looking for the information from, clearly state what you're looking for. There are some exemptions to some of that information, but when agencies post that proactively, it's right there at your fingertips. You don't have to wait for somebody to look through it, to find it, to send it to you. And I also think that a lot of the information, when we talk about big data and making it digestible or in a way where people can understand it, I think the state agencies also do a good job of, having it in a way where it makes sense, that it's not just you're downloading a text file with, all this information in it. You can go into a database, you can enter somebody's name, you can enter, whatever field you're looking for, and you can find find that information. But again, I think the Freedom of Information Act is really important. One of the premises of it is that we want to have access to what government is using to make decisions, whether that be notes or reports or testimony for bills in the legislature, or data. If government is going to use data to make a decision, then the Freedom of Information Act gives people access to that same data so that they can look at that and they can understand why a particular public policy is being implemented or why a policy is being changed in a certain way. So I think access to data is really, really important. And the other thing too is state government is going to be using this data for a particular purpose, but because public resources are going into the collection of the data, it's a public record, and researchers can be using that data maybe for another purpose. As Scott said, this isn't something where the state is doing research or doing this in certain ways, but it doesn't mean that somebody in the public can't take that data set and use it in an entirely different way and maybe come up with an idea or something else that the state wasn't considering, but might also be beneficial to raise as a potential concern or a potential issue or a potential public policy. So, a lot of access to state data, and again, a lot of this is available even without a Freedom of Information Act request. And I think some of you, if you're maybe in the room, you're familiar with this, but if you haven't, and you go and you look online, CT data. There's a lot of information that is available right there at your fingertips, which I think is great. I think it's a great step towards transparency that, look, if government is collecting this data, if we have these data sets available and we can do it, why don't we just publish them, as we're producing them, right? We want people to see the information that we're using to make these decisions.
Thank you so much, Russell. And well, Michelle, first off, I love the Connecticut Data Collaborative. I'm on the website all the time, and I encourage everybody to check out the Connecticut Data Collaborative website, take a look at all the maps and cool charts that they have. But I was wondering, could you share a couple of recent examples of how the Connecticut Data Collaborative has used these huge data sets and made them more digestible and usable for the public?
Sure, yeah, happy to. So Russell referenced the OpenCT websites and the comptroller's collection of payroll data. We recently put out a story analyzing that data. It goes from, what we did is we took 2016 to 2019 and 2020 to 23 data, and we looked at over time how have things changed in the state. So looking at all the different agencies and employment and headcount and what's changed, what hasn't, particularly with the retirement tsunami. So have the agencies relied more on part-time? They have an official name for it, but I'm going to say like part-time retirees who come back, or retirees who come back part-time. It's a better way to phrase it, but there's an official name to that. So what we did is, as like you mentioned, is oftentimes people don't have time to go through these large data sets, even though the Comptroller's Office and the Open Data Portal do a very nice job of putting all the data out there. It does require time to then sift through it and make sense of it. So what we try and do is do that for the public. Another example we just released this week, we took the Secretary of State's voter registration data, and then we took the census puts out eligible voters. So we looked at the compared between down to the block group level, so it's really down to like a neighborhood level for the entire state. So on the map, you can see where there's neighborhoods of potential voters that could be eligible to vote but aren't registered. So where there's a higher percentage. So anybody who's doing get out the vote efforts could target particular neighborhoods. And we work closely with the Hartford Votes Coalition here in the city. That was actually the impetus for the project. But because we were pulling the data, it doesn't make sense just to pull the data for Hartford. It makes sense to do it for the entire state. Yeah, because it's about the same amount of time. So that's what we did. But really, it was in partnership with the Hartford Votes Coalition, Hartford Foundation for Public Giving as well. Another example, you mentioned licensure data. So when nurses register for a license, they have this huge long survey that they have to fill out that asks them a whole bunch of questions, like where they got their education, are they licensed in other states, what kind of facility do they work in? Like, are they working in a hospital or an outpatient, or are they even working in nursing? Many nurses renew their licenses but don't work in the nursing field, what we think of as the nursing field. So working with the Department of Public Health who collects this information, and it didn't require a Freedom of Information request, it was just through collaboration with the Department of Public Health, we gained access to that data set so that we could then say, because we don't know this, how many nurses are working in the state of Connecticut, how many registered nurses do we have, but then how many are working in the hospital setting or not working in a hospital setting, how many are working full-time, how many are working part-time. So that's something that we try and make sense of the data and make it usable for the public. So we worked closely with the Connecticut Center for Nursing Workforce to help them understand the landscape. We geocoded the data as well so we could identify where nurses were living and working, and that helped them with their policy proposals and thinking about, it also helped the state to identify, is there a nursing workforce shortage? Where might there be a shortage? So that's what we try and do. And I thank you for the plug, but ctdata.org, you can find all this information on our website.
Mm-hmm. Thank you so much. Yeah, this data is particularly helpful for nonprofits, is to know with where to put their efforts, right? Where to put their money. It really helps them be able to plan better for the future because most nonprofits definitely do not have the capacity to analyze these huge data sets. So work like that is very, very useful. All right, so how about a question for the whole panel? What is data bias? This is something that we really, really also need to touch upon when we're talking about data. So what is data bias, and how could we ensure that the data that we collect and use by government agencies remains unbiased and accurately represents diverse populations?
All right. What Susan will also say when this gets to her, there's a life cycle that we encourage, and other people do the same thing, to think about for data. So it's not just, the senator mentioned data collection. So it's not just the data collection, it's sort of like how it's managed, used, and all of these different factors. And I'll go back to sort of what I was talking about earlier, and really the initial part of that is sort of the policy and the planning phase for it. So at least as far as government is concerned, like, we don't collect data on a whim. We collect data because there's a policy. And so as much as possible for individuals engaging in the process of public deliberation and development of policies is important, so that when there is some decision made to collect or data or run a program or something, that's thought through what the potential biases would be. Then once there's something where someone says we're going to collect the data, the planning phase is really the start of that kind of life cycle. And as much as possible, I think what we try and do, and I'm sure we're not always successful, but what we try and do is make sure that planning phase is broadly inclusive, and that we're bringing together a lot of different perspectives. As I think in Susan's bio it mentioned, we have an affinity group that we work with different types of folks from state agencies to talk about issues of potential bias in data that they're collecting, that they can kind of talk through how would I do this differently. They can work with each other. We're getting different perspectives from different types of agencies on that. And so we're trying to make sure that people have a way that at the earliest phases of the kind of that data life cycle, that there's thought given to where there might be potential bias kind of downstream from that, and then just really like interrogating that through the process. So when the data is collected, how's the form put together? What are the data elements that are there? What's the language that you're using to call those different things? When you collect the data and it's managed by the agency, how is it reported out to the public? As we've talked about, the transparency and the use of data is really important. So we manage the state's open data portal and the open data efforts there. And we've gone through a process of going through and making sure, is the language that we're using on the portal inclusive? Is it sort of accurately reflecting things? Is it complete? It's really, this is not the sort of sexiest part of addressing bias, but making sure that it's complete and sort of documented for people, what you call metadata, the data about the data. That's an important element to make sure that we're not inadvertently sort of privileging one type of population or one audience in their ability to understand and interpret the data. So I think really that life cycle approach of just looking at every different stage, from collection to analysis to management, dissemination, reporting, that's, we try and instill and reinforce that with state agencies, throughout. We just issued guidelines for state agencies on how to visualize data, how to make it accessible to the public, both in terms of just the ability for somebody with some type of visual impairment or something to be able to access it, but just so people can sort of read and understand it. And so trying to make sure that we're reinforcing those things at each point. That's the main thing I think that we're doing, but there's potential for bias at every point in that life cycle. And so it's not just the use of it, it really starts with like the development of the policies, the planning, the collection, and it all follows downstream from that.
And largely that's because humans are involved in every part of the data life cycle. So that's really why we end up with bias, right? So there's somebody making a decision about what to collect. And then how is it collected, right? The mechanism through which you collect the data. Is it a survey? Is it, a transaction? And then, in the analysis, what am I going to look at? What records will I include? What will I exclude? Those are all decisions being made by humans, and unfortunately, we all have biases that get entered into, whether we recognize it or not, get entered into the decision-making process. And then what do you report? Like, do you report everything? So those are, just because humans are involved, the bias is there. So it's really in the data world, and then the work we do is just really trying to think critically about and asking the questions, well, how is this data collected? And do we trust it? Is this survey representative? How was race ethnicity data asked? Was it asked? Was it self-reported, or was it observed? That's a big question when looking at data. So. Yeah, I'll let the other panelists add too. I know Susan has a lot to say.
I don't anymore, because actually,
I know
Michelle and Scott actually said most of the stuff that I would have said about this. But one of the things I will just generally say is that, I don't consider data to be neutral. I don't consider it to be kind of ahistorical or acontextual. So obviously, as folks have noted, that there are opportunities, unfortunately, for some subjective influences to permeate the data. And it's also thinking back not only to some of those things analytically that we have to be thinking about across the life cycle in terms of how we infuse issues of equity, but also just knowing how certain populations potentially get into administrative data sets also necessarily can impact those data and what conclusions that we can draw on it. We know that there are certain agencies that folks, there are certain communities that may be over-surveilled, so therefore they may be overrepresented in certain populations, and so therefore, if we're making certain conclusions from those data, those could potentially be skewed, they could be flawed, they could be specious, because again, we don't necessarily have that broad representation, and that there are other decisions that have been made in terms of whether or not someone potentially is reported to a particular agency, or potentially someone who has certain information to be put on a who may be on a waiver or what have you. So all those things also necessarily impact those concepts of bias. So in addition to all of what both Michelle and Scott noted in terms of how we think about it in terms of the data life cycle, there are those kind of things that kind of are the precursors to actually engaging the data that do potentially infuse bias into those data.
I'll just add, I think really collection is really important. One thing I can speak to is when I was at Hartford Public Library, one of the things we did was try to support census outreach, and that was a critical thing because, the census is maybe one of the most well-known, data sets that's collected, but if you don't have multiple ways to reach people, if you're not sending people out into neighborhoods, not everybody is going to be able to get a postcard in the mail and go online and fill out the census like maybe some of you did. You have to account for all these different factors. You have to account for people who, English is not their first language, and how do you account for that? And that was something the library worked on, outreach in different communities and thinking of different ways to get people to fill out census information, just kind of having it available in places where people may not be looking for it, but they see it, and then that was the way that they would be responsive, to that data. So I think collection is really important. And then one other thing I can speak to on this, in my past life as a journalist, I was always, data is very, very helpful to journalists. There's a lot of people who are data journalists, so they write a lot of stories about data. But in my perspective, I think it was always important to go on the ground level and talk to people too, because sometimes you may get a data set and you're talking about how people who are over surveilled, the data set doesn't represent something. The data set could not represent what's actually happening. So sometimes when people are reporting out on stories that are really driven by data, I always felt like it was important to go find the people that represent the data and talk to them and see and make sure that the data is lining up with what's being represented. The situation on the ground is lining up with what's being represented in the data. Another example, it's not necessarily data bias, but my other major in college was political science, and people talk all the time about polling bias. When the advent of cell phones, when that was a newer thing, and polls were still doing landline calls, the poll would look a lot different sometimes than the election, because you had all these people who didn't have cell phones who were not part of that group. It was supposed to be a representative sample of people for a poll, but if you're only polling people who answer the phone, when they pick up their phone at home, and even today, if you poll cell phones, how many people in this room do you pick up your cell phone when somebody calls who you don't know? Or you get a text poll and somebody asks you to respond to that. You almost inherently, those kind of data sets are not going to be complete because the way that you're trying to get the people to respond to you is not necessarily going to account for all the different ways that people interact or the different ways that people will respond to someone seeking data. So I think, it really starts at the beginning. It's the whole process, but the beginning is so crucial because if you don't collect the data in the right way, then it's going to, be biased from the start. So whatever you do with it, however you manipulate it, however you report it out, if what you get in, doesn't represent what's happening, that's a real problem.
Add something to what Russ was saying too. It's something that Senator Blumenthal mentioned, and I don't know if it'll come up otherwise, but at the collection point, the really important question of consent and making sure that individuals understand how their data is being used or supposed to be used and being clear about that kind of upfront. That's an important element of the collection practice, whenever possible, to be gathering consent, making sure people are informed about how their data is being used. That's important. It creates challenges kind of downstream. It limits, it can even sort of bias the data set because you have people that would opt out and then your data set is not sort of complete. But that's a balancing act the people have to make a decision about, but I think that in general, that's kind of worthwhile. Again, for the overall effort of trying to build trust between government and the public is making sure that people understand how their data is being used, and that critical part about gathering consent, whenever possible, or be at minimum being transparent or providing notice about how that data is going to be used. That's a critical component. We have someone working now on gathering sort of together the consent requirements across different types of state agencies, so that it's an easier process for agencies to understand their own ability to do that and give them some tools for that. But that again, I don't know if that would naturally come up otherwise, but I wanted to make sure we're talking about that.
Thank you. Yeah, so piggybacking a little bit off of what Russell was saying about the census. Susan, so Public Act 2135 has codified race, ethnicity, and language standards in Connecticut. And I was just wondering, how will this impact the presentation and the use of big data in the state?
Sure. So I don't know if folks are familiar with this particular piece of legislation. So it was promulgated about 3 years ago. I think the actual act is called Equity and Comprehensive Access to Behavioral, Physical, and Mental Health Care. And there are, it's like about a 28-page piece of legislation. But one of the things that came out of it was, first and foremost, that the legislature identified racism as a public health crisis in Connecticut. And among a variety of things that they identified was better collection of race, ethnicity, and language data in order for us to obviously get underneath the issues that obviously are part of that public health crisis, as well as potential performance indicators in terms of reducing that issue. So one of the things that specifically has been required is that state agencies collect race, ethnicity, and language data in a more standardized way. So the Office of Healthcare Strategies is leading this effort, and any state agency that is collecting REL data for the purposes of public health or the provision or receipt of healthcare services are to comport their data collection and reporting to these new standards. So for the past couple of years, we've been working on what that needs to look like. Folks may also know that the Statistical Program Directive that the feds also released recently, SPD 15, also made some changes in terms of how race and ethnicity data are collected. Just very, very quickly, a couple of things that came from that is that the MENA category, Middle Eastern and North African, has been pulled out from the white category and will now be a discrete category. Hispanic had been asked as a separate ethnicity, yes, no question. That's now part of a consolidated race and ethnicity grouping. And so the expectation is that state agencies will now collect those health and human service agencies that are collecting those data for those health purposes will conform their data systems and forms to those new categories, as well as giving people an opportunity to also say, I decline to answer that information, allowing folks to answer multiple race and ethnicity categories, as well as to provide more granular information. So it's, I'm white and I'm German, I'm black and I'm Jamaican. So folks are able to add more information, more granular information. And I think that this is actually really a very positive step in terms of the collection of these data. And I know, again, all the conversations we've had about how sometimes it can seem very scary and it can, seem like we're just over collecting. But I think in terms of really helping to get underneath some of these really intractable problems, really helping us to understand where issues of disproportionality and disparity exist and potential, areas of discrimination, that having more discrete race data is very, very helpful for us to really dig deeper into these types of issues. And also, again, because of that standard and having that consistency, will also allow us to potentially look at those data, responsibly and with, appropriate protections and what have you, across state agencies to get a more holistic view, but do it in an easier way. Now, because we all are all over the place in terms of how we potentially would collect it, it could be very, very difficult to really see how certain populations were faring. Did we see that there was equity in access to services? Did we see that people were getting the level of utilization and penetration that we want? Are folks satisfied equally with the services? Are we seeing positive outcomes? And it can be a challenge to really kind of look at that across state agencies. So this change hopefully should make it a lot easier for us to do that. And then also kind of the benefit for constituents who are really wanting to look at data potentially across a variety of different state agencies, being able to really look at that in the same ways that will allow them to hopefully, as I think folks have stated here, really kind of help us to get to some of the why of some of the outcomes that we're seeing and why of some of the data that we're seeing.
Thanks so much.
Just to add to that, by standardizing it and matching the state agency data collection with the federal federal race, ethnicity, language data collection, it then allows for us to do more population level comparisons, right? To look at who's being served versus the whole population that exists, so we can better understand. Yep. And I think you talked a little bit about this, but just what percentage and who actually are we serving? Right. So that's like a really positive move that this legislation did.
Right, and one other thing I will also add to that, very much that point of obviously being able to look at those aspects of, disproportionality and disparity indexing, but also, hopefully state agencies are also looking at making those changes across their myriad programs, so not just those services that specifically are in that healthcare realm. So we're looking across our agency and saying, okay, for, I see one of my colleagues in the room, protective services for the elderly, we're looking at how do we change, make sure that system is up to date, or child support or what have you, so that we're all looking at the data in the same way. But it also helps us to start thinking about those issues of wellness and social determinants of health. So when we're able to bring in those components of the data, obviously we can have much more robust and very sound, policy and program development and decision making.
Thank you so much, Susan. Now, Michelle, coming back to you, so we've talked about database bias, and I think that one of the best ways to combat data bias is data literacy, right? So could you tell us a little bit about what data literacy is, and what would you think is sort of the average level of the average person with data, and what can we do to become more data literate?
So the definition that we use internally at CT Data for data literacy is the ability to systematically and ethically ask and answer real-world questions with data. What we do at CT Data is we have what we call the CT Data Academy, which is we hold data literacy workshops, and we hold them across the state. We have an intro to public data, we have data analysis, data visualization, a survey design course, and then and there's ones I'm missing, but if you go to our website you can see more. But really it's about, we work a lot with nonprofits, and so something that we've found in our work with nonprofits, in Connecticut there's about 60% of the nonprofit workforce are women. And I have found that because of our socialization in our society of women not believing in their ability in math or numbers, we go to these workshops, and a lot of them that we lead, a lot of them are nonprofit professionals who attend, majority women who attend our workshops. And I'm not a data person, I don't like numbers, I don't like math, and we hear this over and over again. So, which just helps me believe that we need to do more data literacy work. I think there's a lot of work to be done to increase data literacy. We teach numeracy in school, but we don't really teach data literacy. So how do you be curious, right, and a critical thinker about, and we don't really introduce real world data in school. And we do run a youth data fellows program for Hartford youth. And I see it in the youth that come, some of them have never even used Excel, and never even heard about public data or seen or used it, but they get so energized because this is the data about their community, and now they can, analyze it and do something with it, and we really encourage them to, advocate, and we hold a data walk for them to advocate what they found and their findings. But I would say there's a lot of work to be done around data literacy, but I think it's changing, right? Because we all now are talking so much about data, particularly now with AI. I think our whole world is going to change. But I don't know, did I answer your question? I think there's a lot of work. I don't know that the data literacy level is where it needs to be, but there's definitely a lot of interest. And so we're getting there.
Yeah, that's good. Thank you so much. And then Scott, once we have all this data, once the government has collected their data, what happens to this data? Where does it go? And how does the government keep it safe?
Those are great questions. So data literacy is a really good building block for kind of what the state does and can do with data. So as we were discussing earlier, for the most part, government collects data to run, administer programs, implement policies, and so it's for some reason. The opportunity when we can sort of build capacity and increase data literacy among state employees. There's 30,000 state employees. There's a lot of people. Every single one of them touches data in some fashion in their work. As much as possible, building capacity, building people's curiosity. What is this data saying? If you're a state employee and you're working on a program, everybody's really dedicated. Their focus, people are mission driven. You're not there to get a big paycheck. You're there because you're interested in the work. And so people are mission driven. It gives them an opportunity to say, okay, well, what could I do for this program that I'm tasked with administering or running or participating in some fashion? What could I do to make this program kind of run better or be more efficient or reach a population, or am I understanding some bias that's in the way the program is run or administered? And so the capacity building is a critical component of that. We've run the same kinds of training and workshops for state employees to try and make sure that they understand the potential that's in their own data, to be able to analyze that and answer questions about the programs, to be able to report it out to the public so that people can develop the same sort of understanding of it, that we have some mechanisms for accountability with the public. So the sort of default is that the data is collected to kind of run the programs, but when possible, we want to encourage that for the state employees to be able to use that to improve the programs and run better and make sure that it's transparent and accountable to the public. There's a trade-off that I think Russell was talking about earlier with doing that. The more people are using and analyzing the data, the more risk there is for exposure, the more you're sharing something out. And so Senator brought up breaches, that kind of thing. That's a real risk. We're collecting people's information, often very sensitive information. I think Susan particularly understands that. We're running programs. Sometimes they're programs that people don't want to be involved in. Sometimes they're programs that have it's for a population that's had some challenges. And so as much as possible, we want to safeguard that. There's technology can help with that, but it's fundamentally not a technical, it's not solely sort of a technical process. So there's things where you can do to kind of make data safer, but it really relies on the people and the procedures with it. So we emphasize a lot, again, training, capacity building for state agency staff so they understand concerns about privacy, about security, there's security awareness training every state employee goes through. We provide a lot of emphasis on documentation, understanding where did this data come from, what are the limits for what it can be used for, what it can't be used for, and as much as possible, try and encourage agencies, and I will use Department of Social Services as the example here, to build their own governance structures internally, because governance is sort of the root of setting rules for how data can and can't be used, ensuring that things work well, and absent that, you're sort of in the Wild West. And so we do that as much as possible, kind of statewide, but agencies, and Susan's been the leader for this in Department of Social Services, set up their own internal structures to make sure they're collecting data, in many cases on programs, the very sensitive information, making sure there's controls and understanding about how that data is used. And so again, that's really a people-focused process. There's aspects of kind of like the technical part of it, but it really involves people who are working on, dedicated to those programs, developing a shared understanding of what the data is for, how it's being used, how it can and can't be used internally. And so I don't know, the governance is sort of the bedrock for the way in which we want to safeguard data. There's technical controls, procedural controls, legal controls for it, but the governance is kind of the foundation for that.
If I could just add one thing to what Scott was saying. From the FOI perspective, one of the things that I have a lot of conversations about with towns, not necessarily dealing with data, but with other things, I think is also considering, what do you have to collect? What do we have to collect to evaluate this program, and really thinking critically about, do we need to collect all this different data, from people that are participants in this program? Because when you collect it, then it comes in and it becomes, part of the data set, and then it might be used, it might be misleading, it could be biased, it could be requested by somebody through FOI. So I think one thing I think is important too, when government is doing this is looking at that, whatever it is, a questionnaire, a survey, data, whatever it is, thinking, okay, everything that we're taking in here, there's a reason, there's a purpose behind it, and that we're not just collecting all this data that we maybe don't need this question answered to evaluate the effectiveness of the program. I think that's one important step that can be taken again at the beginning of the process to try to safeguard, some of the more sensitive information. If it's not relevant, then you don't need to ask the question, and then you don't have to worry about having that information be something that could be, disclosed or could be used in a wrong way.
And just another step the government does to safeguard data. We recently requested Medicaid data from the Department of Social Services, and so we were interested in young children who receive enrollment in Medicaid, young children. So a very specific population at the town level. So by race, ethnicity. So there's lots of dimensions to that data, and you could, if they just gave us the raw data, the individuals could be identified because some of the numbers are small. So when the department shares data with us, you have a suppression policy of you can't have data over a certain number. So they go through a whole process where before they share it with us, the public or the requester, it has to be make sure that no one can be re-identified. Yeah,
we'll suppress, there's a suppression range so that any cell values that are less than 11 will get suppressed, and then we'll do complementary suppression so that someone can't do the math to figure it out, so that even if a number is over that, but you potentially can subtract it and get it, we'll suppress that to make sure. So, generally, any data that's cross-tabulated at certain levels, like, certain town levels, and the more cross-tabulation we get, then the more likely we are going to and need to and will suppress those data to reduce the likelihood that it could be, potentially re-identified in any way.
Mm-hmm. Right. Thank you so much. And sticking with you, Susan, shifting a little bit, here's a big question. What is data equity, and how is it being integrated and centered throughout the data lifecycle?
Well, I actually think Scott answered most of it in his original, in one of his questions, but I'll add a little piece to it. So, so obviously these are those processes and practices to infuse that equity, justice, and inclusivity lens across the various domains and phases and steps of our data work. And so we've talked a lot about that in terms of how we plan for the collection of data, who may be involved in that, who are the voices at the table, how are we analyzing those data, how are we sharing those data, are there any algorithmic, uses that ways that we may be applying to, those data to. So thinking about, all those components. But I really kind of think about data equity as kind of as sweating the small stuff. So we really are, thinking about, how we are using these data, and oftentimes how we are sharing these data. How do we ensure that equity lens is being pulled through? So we've talked a lot about kind of how we potentially internally as state agencies are using data, but one of the ways I want to think about this is also in terms of how we share data. So obviously there are FOIA requests that may be gotten. We will also get direct requests from researchers who will want to access our data. P20Win is an initiative that Scott's team is overseeing that supports integration of data across state agencies. And so those are all opportunities by which we may be sharing data with persons who are outside of state agencies. So obviously that requires us to have very stringent safeguards to make sure that those data are anonymized, that they cannot be re-identified, and that we have in place those legal, ethical, and just generally respectful frameworks and principles to make sure that we can comfortably share those particular types of data. One of the things that we had put in place was a framework to look at data requests through an equity lens. So some of the things that folks mentioned here, that we are asking the question about, do you really need this data to answer your research question? So we talk about, is this something that's minimally necessary, very similar to the concept of least privilege. So we're only going to give you the data you absolutely need. We're thinking about the way we give you that data. So you may say, well, I want to know the ages. I'm going to say, well, maybe can we give you a cohort? So, because obviously the more granular the information is, the information getting integrated across potentially systems, there we know that folks potentially can scrape data from other sources. We have to be thoughtful about what we share and how we share it, and so we will push back and say, we're not comfortable sharing this variable, or we're only going to share it in this kind of a way. I think Senator Blumenthal mentioned it. So we ask about, well, is it going to be used for a commercial purpose? And so we need to be thoughtful about that, because that too could very much chill public trust, that we're just kind of, as I say, giving people's data away like it's chiclets. We have to be very careful about, those types of things. And so, that to me, that equity lens is really about being person-centric. It's really about respecting the dignity of the people who are within those data sets, and really thinking about it from the standpoint of like, well, if this were my data, would I be cool with this? So we're, often really thinking about, do we have the, authority to share that? And, on that consenting piece, it's not just is consent in place, but when are you asking for consent, and how are you asking for consent? So obviously we don't want someone to feel coerced. There can be an imbalance of power. It's like, well, I'm signing up for a benefit, so maybe I have to sign it or I won't get it. So we want to think about those kinds of things too, so that it's not just simply, well, we have consent, so we're good to go. We need to be thinking about, we look at the nature of the consent. It's not even also the level of legibility or the readability for those, but also people knowing that they can withdraw it and how they can withdraw it, letting people know that it will not impact them receiving benefits. And so really again, sweating the small stuff, and not just simply that kind of high level of, oh yeah, we've done these things and so we're good to go. So we really do try to think about how we pull that equity lens, particularly in terms of how we share data, and also outside from sharing kind of those raw data sets, but also just kind of thinking about, and some of what we talked about is the literacy and the comfort of that folks may have with data, so that we are creating a variety of products that can be more easily engaged and utilized. So again, that equity piece is something that I think that we take very, very seriously, and it really is kind of on the forefront, I think, for most of our state agencies in terms of how we think about our internal use of the data, but also in terms of how we potentially share that with constituents and research and others who may have interest in those data.
Thank you so much. And Russell, everything that Susan just said sort of alluded to this, but I was just wondering, how does the law seek to sort of balance the need for all this data with the need for individuals' privacy, and the right to their own data?
Sure. So, the Freedom of Information Act has certain exemptions and exceptions, and, one example, that I can give is, a lot of times when state agencies are setting up new programs, they'll put language in the legislation enabling those programs, dealing with the Freedom of Information Act about who can get access to that data, is it available or not? Is it only available to certain populations? If it's requested, does it need to be, anonymized? How is the procedure for releasing that data? So there's a lot of, I think particularly when, with the advent of AI and greater collection of data, I think the lawmakers are really looking really closely at providing that access and striking that balance. And it can be hard to find that balance, sometime. This isn't necessarily like a large data set, but, to give an example, Department of Public Health, when they do public health investigations, they're collecting a lot of very sensitive data about people. Think of COVID when there was contact tracing going on. There was all this information that was being collected about who had COVID, who they had been in contact with, how many cases there were in individual towns. I was a reporter during that time, and there was a tremendous amount of data that was being released, but it was being released in a way where you weren't able to identify, the individual person who had COVID. They were released, like you talked about, age bands. They weren't saying, it was an 81-year-old person who lived in Bolton, Connecticut that had, gotten COVID on this day. It was done in ways where, it was protecting the identities of those people. Because it was, using larger age bands. Another example, when the state reports out, test scores, we talked about some of the suppression, and this is another thing I remember from being a journalist. You might be able to go to your local school district and pull up, the test scores, but, if there's only one Asian student in 4th grade at a certain school, then that test score is going to be blank, because if it's reported out, then somebody could very easily identify, or even if it's a couple, that there would be ways that people could use that and find out who that person is. So I think, the FOI Act has certain exemptions, and I also think that when these programs are being created, especially now more than ever, I think that we're more familiar with the concept of data collection and what data collection can be used for. It's putting those safeguards in place. And I think the way I always look at it is, the more you can deal with aggregate data to a point where you're not identifying an individual, but you're looking at things like trends, you're looking at things like, certain populations and larger groups, and trying to, to find that it's not about the person, individually, and certainly as a reporter, when we were reporting stories driven by data, it was not about the individual people, but it was more about the trends. Certainly trying to find people maybe who are representative of the data. But I think, the law has a balance there. Sometimes it can be difficult. I imagine there's researchers who probably want, every single individual cell of data. But there's also this balance too where, particularly if people are, this data is being collected through some of these programs that people are having to participate in. You want to have that balance where people feel comfortable participating in participating in a program, understanding their data is being collected, but also understanding that there's safeguards in the law where the data can only be used for particular purposes, or if it's released in such a way that it's not going to identify an individual.
Thank you so much. Okay, we're running a little bit low on time, and I do want to leave a little bit of time for questions from the audience. So just as a sort of wrap up to our discussion today, I was wondering if you could all sort of briefly let me know how you believe that using data can have a positive effect on our communities, and what do you hope the use of big data can achieve in the future?
I will say I'm a tiny bit skeptical about the use of big data. I think really trying to narrow the question is a good way to think about it. Often that means you're answering it with like small data rather than big data. And again, trying to figure out like what's the question you want to answer, getting the data set to sort of answer that question. The points that I think folks have brought up earlier about, do I need to collect this data at all? Do I need to use this data to analyze something? Researchers who are wonderful want all the data to answer a question. You don't always need that. So trying to, rather than like broaden the question and say like, I've got this big blob of data, I don't know where it came from, and I'm going to use some complicated techniques to analyze it. Really trying to like narrow the question. I think that's where you're going to get more benefits, and it's just sort of easier to go through the process to do that. How can data have a positive effect? The mantra I think that we use in our office is to inform policy and practice, those two things. That's why we collect the data, is for policy or practice, the implementation of programs, and that's the potential for it, is to inform the development of policy or the changes in policies, and to inform the practice of the business of government doing and running programs, making sure that they're benefiting the public, that they're run equitably, that they're run effectively, they're reaching the populations, and that when we need to make adjustments, that there's a way to identify that this program, this thing that we're doing, we need to adjust, and that informs the policy development cycle. And so like we collect data for policy and practice, and that's the real potential to use it in my view. And that's again it's part of the whole process of government. So like through your elected officials, through the agencies, through tools like FOI and nonprofits like the Data Collaborative, to be able to provide a kind of a window into what the government's doing. But we collect data for that reason, and that's where there's a benefit for it as well.
Okay, I'll answer it in two ways. First, just thinking about big data. I mean, I think that there's potential, and there have been some examples of where the human brain couldn't just possibly alone identify patterns. So I think that that's where big data can have an impact. Particularly, I don't know if you all are familiar with this example, but lung scans were fed into the AI black box, and they identified cancer, which a radiologist looking at the screen looking at the image couldn't identify that this person was going to get lung cancer, but by feeding in trillions of terabytes of images, the black box of AI was able to identify this pattern and find it. So to me, that's a positive, right? To do things that one human brain can't do alone, identify patterns that an individual can't identify. We work a little bit more in smaller data. So what we're trying to do I run an initiative called the Hartford Data Collaborative. We're trying to link nonprofit data. So look at youth-serving organizations across the city, take their data, aggregate it together, and then link it in the future with P20 data. So we can say, well, how many youth are being served in the city of Hartford? We can't answer that right now by different programs. How many individuals are being served by multiple programs or one program? And then be able to look at, okay, then what are the educational outcomes? Because we have SDE data, or what are the employment outcomes? Because we have DOL data. And so to try and understand what the effectiveness of our programs, or are we missing youth because we're not engaging with the whole population. So that to me is a positive, when we can then link data across and really look at a systems level of what's happening, as opposed to individual programs or individual outcomes. We're really trying to look across the system.
So I'm thinking about this rather than specifically about big data, but just generally kind of what's the next step in terms of data in Connecticut. And really it's my hope that we can encourage and invite more constituents to engage the data that we have available in various ways in the state, and really help us to get underneath kind of that why and the how. So almost kind of the crowdsourcing kind of approach to this, and really helping us to kind of build the governance. So governance is still, I think, in its nascent stage, and it's also very dynamic. So the things that we talk about now are not things that we talked about, 2 or 3 years ago, particularly with respect to AI. Even though there are those aspects of it that have been around forever, we're now seeing, responsible use frameworks developing here in the state and other places. But I think I hope that, the constituents will help us to build some of these out, help us to answer some of these questions about how we can ensure that their information is used respectfully and appropriately, and really helping us to think about how do we put ourselves in good stead for the future use of these big data, particularly with some of the AI-related activities that we know are coming. So I do hope that we'll start to build broader coalitions and collaborations with our communities to help us inform these areas.
Thank you so much.
Just briefly, I think one interesting thing I was just thinking of as you're talking about, greater access to data. I think connecting people with the data from their communities is really important. That allows people who are on the ground living in these communities to learn more about what's happening and propose policies. Data is a really important aspect of policy making, as we've stated, and also for evaluating the effectiveness of policies. If you want to decide to make changes. Many of you may not think of this, but when I worked at Hartford Public Library, libraries collect a tremendous amount of data. We're always looking at how many visitors we have, how many programs we're doing, how many people are attending those different programs, what books are being circulated. So even in a place like a library, there's a tremendous amount of data that's being collected, and it's used to make decisions about, what types of books are you going to purchase based on what other books have been checked out. Are you going to consider extending the hours at a certain branch, based on the foot traffic at a certain time? So, even in a system like that, we were collecting data. Some of that was being reported on the state level, but also just for our own internal use to really make decisions. So whether it's very big data like we're talking about, or even something as simple as how many people are visiting the library on a certain day, data can be tremendously important for decision making. And I also think, again, allowing greater access to this. We have a lot of people in state government who are experts in data, and they're doing a lot of important things with data, but there's also a lot of other people out there who may have different ideas. So I think the more, I know we didn't get to the question, but the democratization of data, there are people out there who can do incredible things or have incredible ideas, and the more access there is to this data, the more likelihood there is that they can use that in some kind of positive way.
Mm-hmm. Thank you so much. Right, I think that's a wonderful note to end on, like how knowing data and having access to data will allow us to be more civically engaged, right, in our communities and abroad. Well, thank you so much, all of you, for this wonderful conversation. I would like now to be able to open it up to the public. If you have a question, please do just raise your hand and wait for the mic.
Thank you. That was an excellent discussion. I appreciate it. Ms. Smith, I was actually one of the big advocates of the REL data. We worked on it through Connecticut Health Foundation, and it was a learning experience. It took us about 2 sessions to get that through. And because of COVID, there was the urgency of COVID. My question is, at that time, we also found that people do not readily give out their information. They're scared about giving out the information. But putting it in a statute, that helps a lot, brings confidence, and it will help for social determinants of health. My question really is about meaningful consent. Meaningful consent being if the patient or the consumer gives you the data, and there are statutes and there's it is by binding. You can opt in or you can opt out. Right now in the state of Connecticut, it is opt out. Means you are giving consent. If you want to retract your consent, you have to physically go, actually make an application to retract your thing. How about if we strengthen that? We need meaningful consent for public data, for individual data. There's another reason why, and the public health crisis of behavioral health. We had the opioid crisis, we had high behavioral health problems. The only thing that stopped it from our life, it really is COVID. COVID intervened, but the behavioral health issues are still there, and people will not give out their meaningfully their data. So I think the data problem, and in light of the AI tools being available and the analytics, the meaningful consent is extremely important, and we need to work on it. And I think I want to ask you that, how would DSS, that manages Medicaid, but there's also DPH and OHS. Actually, I was in the council of the Health Strategy, Office of Health Strategy. I was in one of the councils. But the meaningful consent is extremely important. How would you go about, from an agency perspective, to bring that about, maybe for a statute or anything like that, some instrumentation to have meaningful consent for data? Thank you.
Thank you for that. So I absolutely agree with the importance of consent, and I think, with my remarks, I did speak to the fact that I think it's really important that we think about kind of how and when consent is asked of folks, particularly with data that may be used for research. I think you may be talking about one of the Connie systems and those data. So I don't necessarily have an answer to that per se, but I can certainly talk to data, the raw data collection within DSS. So it is not a mandatory field, so we do not require it. We do not, so we will process a person's application, and we will continue to work with them regardless of whether or not they answer that question. We are looking at, as part of the implementation of these new standards, how can we make folks feel more comfortable with sharing that, because I don't necessarily know if we've done a really good job to talk about, well, how do we use it? Or what don't we do with it? How do we protect it? How does this potentially benefit you? So as part of a feasibility study that we're doing within our agency to look at some of the system changes that may need to happen, some of the changes to forms that we're going to need to do, but also what's our approach to this? How do we socialize this change, and also to make sure that folks feel comfortable providing that information, to us. And so from that standpoint, I do see that as kind of a sibling and a partner to that concept of consent, because again, we know that there can be imbalances of power. We know that in certain situations that folks may feel they have to provide that, and I don't think anyone should have to feel compelled or just doing something because they're perhaps not in the best situation in their life, so they're going to just do whatever they need to do. So I think if we can hopefully put in place materials and do training, with our staff about how to ask those kinds of questions. I know sometimes that can be a little bit of a challenge. So really taking this from a multi-pronged, standpoint, and hopefully, continue to think about this as we start to unfurl other technological advancements that, as you indicate, have potential implication in terms of high-risk decision-making and things related to persons kind of well-being, that we are thinking about whether or not we have the appropriate consents and how we've obtained those.
I just want to quickly add, may I send a 6-page paper I wrote to the Panelists?
You're welcome to send it to me. So yes, you're welcome to send it. So you're welcome to. I'm happy to review that. So it's definitely an area. Scott knows I'm a pain about some of that, So about consent and stuff, he knows that I can sometimes be a little bit of a skunk at the lunch about it. So he's nice about it, but he knows that that's one of the areas that I am also always thinking about.
Any other questions?
Hello. I just had, it might be a little bit outside the scope a little bit, but I think when people think of big data, a lot of times it's private enterprise, right? Like the vast majority of big data is, not just social media companies, but every single company that you engage with, they have your data. The vast majority of leaks come from, and breaches come from private enterprise. To what extent does government data collection and data processing remedy that, accentuate that, complement each other, in general, like what is the interaction or interplay between the two?
Very little, I would say. So there's, from being inside government, and my other inside government colleagues, welcome to chime in on this. There's really, there's not a ton of kind of interaction between how the private sector collects data and how government collects data. Again, like the way government collects data is fairly restrictive. We can't turn on a dime. We don't collect data on a whim, et cetera. And we collect much less data, again, than I think people often think, and probably almost certainly than the private sector. So the government is in the business of running government. It's not in the business of sort of making a profit. And maybe there's two ways of kind of thinking about the question here. One is, does the way in which government collects data exacerbate some of the risks that are in the private sector with the massive breaches? I got a letter yesterday. I'm going to get another one from AT&T about the way my own information has been exposed in countless different ventures. So it happens a lot in the private sector. They collect a lot of data. Private sector is just bigger than government. Government, I don't know, is influencing or kind of adding to the problem in any way. It's pretty minimal what government collects. There's a lot of controls around it. And again, for better or worse, the sort of the tools and the technology they're just a little more antiquated. The breach for AT&T in the last couple of weeks was like a cloud provider. The state is still migrating to the cloud. So like some of the things that are sort of the norms in the private sector are not the case in the public sector. The other piece where there is an important interaction between the public sector and the private sector is on sort of the development of standards and policies and the regulation of how the private sector functions. AI, which we were talking about earlier, is probably the current kind of example of that. Most of that occurs at the federal level. There's some that occurs at the state level, but it's really kind of a federal question. We have state laws about consumer data privacy, but there's for the first time, a proposal to have a federal privacy act. Whether that will happen or not, I'm unsure, but that's the main role, I think, of government in terms of the private sector is really to develop the standards, policies, and procedures that apply to the private sector, and to do that in a way that doesn't sort of stifle innovation and all of those things. But that's really, it's more of a federal than a state kind of question.
Thank you.
I wanted to ask you a question. I've also been a victim of a breach with the federal government, Department of Justice. I'm sure we all have. But the question is, and I think you might have answered, but I didn't quite comprehend at the time, and that is, what is the legal compliance with government regulations? What is the legal compliance with government regulations so that we all can be in the know of what's going on, if you know that answer? Thank you.
The answer to all questions is it depends. So that is, unfortunately. So I know the way kind of the state handles it. There's recourse. So if the state were to expose information, there's kind of recourse. You go to I believe it's, I realize we're being recorded, so saying don't quote me on this is sort of silly. But I believe there's a reporting mechanism to the Attorney General's office. If an agency exposes information, we report it to Attorney General's, auditors of public accounts, the comptroller. So there's a variety of kind of mechanisms in place in the state to make sure that if there's information exposed, it is reported promptly to multiple different authorities. Notices provided to the individuals. Again, the letters that you get, that I get about it. So I know from the state side, that's kind of how those things are handled. Federal government's a little different. Private sector, the requirements are different. Connecticut's requirements for consumer data privacy are different than Massachusetts or New York, and so it gets kind of more. That's the it depends part of it. But I hope that helps.
Mm-hmm. Yeah. Any other questions?
Hi. Just wanted to ask. Is the data that is collected by the government and other public programs, is it available for the public? And if so, can it be used for commercial purposes? And I guess third question, is the panel okay with that?
These are good questions. Yes. This is a Russell question. So,
or business registration.
Mostly it's available to the public.
Yeah, I would say most of the data is going to be available to the public, and under the Freedom of Information Act, the purpose that the person is requesting the data is not determinative of whether or not they get access to it. Basically with FOI, the standard, the presumption is disclosure. unless there's a law, we talked about some of these different data sets you can't get access to. That's all because of, there needs to be a legal reasoning, when a program is created. They put something in the legislation that says, the data is not accessible. But I would think by and large, it's available to the public to do, whatever it is that they want to do with it, whether it's research, whether it's commercial, whether it's personal use. Typically with FOI, the purpose behind the reason the person wants the information, is not relevant. So, I can understand, why some people may not like that somebody can, take public data and use it for a commercial purpose, but, at least with the FOI law, it doesn't make that determination. Certainly when government creates these data sets or in the statutes, they could put parameters on that, if they chose. But unless there's something in that legislation that talks about that, then the presumption would be that it would be available for whatever purpose somebody wanted to use it.
An example is business registration data. So many companies take the business registration data, they package it up, and then they sell it. Dun & Bradstreet's an example, because you want to know how many you want contact information for businesses for whatever, myriad of purposes. We used to provide the business registration data on our site in a nice Excel format, and we got thousands of hits because it was a way for like the Dun & Bradstreets of the world to just pull it down easily, as opposed to before the state migrated to a Salesforce platform, they would get the CD of the data.
I will say that I think, like Russell was saying, a lot of times people do not like that data might be used for a commercial purpose. And when that comes up from the government side, what we tell them is if someone can access it for a commercial purpose and you're not comfortable with that, you should just release the data publicly anyway, because if there's no restriction or on access to it, and you don't want people using it for a commercial purpose, release it so that then anybody could make use of it. And I think that's a support for transparency. If you're concerned about that, you should just publish the data that's there.
But I thought it would be a fun question anyways. I'm with the League of Women Voters. I'm president of the League of Women Voters for the state of Connecticut, and we're getting ready to put up a billboard. And so, because you are data influenced, we thought about Bridgeport, New Haven, Meriden, or Greenwich. Any suggestions?
So look at our map that we just put out, and you can know specifically what neighborhood to go into. So you can see how many registered voters there are, then how many people living in that area are 18 and over, so your potential registered voters, and the difference. So like where you're going to get your biggest bang for your buck, the higher the percent.
That's exactly.
Yeah, that's what you need. Yeah, so go to our website.
Or I would say DOT probably keeps traffic counts. You probably could ask them, and they could tell you how many cars go by each of those sites, and you could use that too. So
that is true. DOT publishes traffic count data. You can get it through the open data portal, and it is accessible. It'll take a little work to analyze it. Meriden's probably a good idea. So.
All right. Well, thank you so much. That wasn't me. Thank you so much to all of our speakers. That was a really wonderful conversation. And thank all of you for joining us today. And I hope you will come back next week for the last installment in our Ctrl+Shift+Democracy series, where we'll be talking about digital equity and the digital divide and the digital equity. That's right. And I hope we'll get to see you there again. Please grab some more snacks for the road, and I hope I get to see you again next week. And remember, if you have a parking stub, to get it validated downstairs in the visitor center. Good evening.
Thank you.